I'm Dr. Allan Perel, and this is Conversations in Medicine. I'm Dr. Allan Perel, and this is Conversations in Medicine, a program dedicated to bringing cutting-edge medical topics to the Staten Island and tri-state community. It's my great pleasure. I have two wonderful guests here today. Dr. Neil Mitnick, who's a general dentist on Staten Island.
Hello,
Dr.
Allan.
Robert Novo, an oral surgeon who practices mostly, I believe, on Staten Island.
Yes.
It's a pleasure. Thank you for coming by. And we're going to talk about dentistry. And dentistry, some people get frightened just by the word dentist. So tell us a little bit about dentistry, and Neil, maybe help me. What is a dentist, and what's the training a dentist goes through?
A dentist is a kind of doctor for the teeth and oral cavity. That means the mouth. You go to college, take your prerequisites like pre-med, and then you go to dental school. And there's a residency. You could elect to go into a specialty, or you could be a general dentist. I'm a general dentist.
Which means you take care of all aspects of dentistry.
But not 100%. When I see something is too complicated or it requires a specialist, I refer it out.
But you're the first person someone goes to.
I'm a primary care dentist, yes.
Understood. And Dr. Novo, Robert, tell me a little bit about an oral surgeon. Is that a dentist, or for the people out here who are referred to oral surgeons?
Oral surgery is a specialty within dentistry, and all oral surgeons are dentists. But some oral surgeons are medical doctors in addition to being dentists.
Okay, so we're going to get into some of the science of dentistry. Let's go through some general aspects. I mean, we have some pictures of teeth over here. Tell us about teeth. How many teeth do we have? When do we start getting teeth? And when do we have to start caring for them?
Your teeth start to form when you are neonatal. They are in your head when you're born. They don't erupt until, which means come out into your mouth, until anywhere from 6 months to a year and a half. But once you have teeth, they can get cavities. They have to be taken care of.
So even young children need to be followed at a dentist?
Yes, children should go to the dentist. People ask, when should a child go to the dentist? And I say, when they have teeth. Generally, when a child is brought in who's very young, I'm really talking to the parents. I want the parents to understand that even though a child isn't cooperative, it's important to keep their teeth clean. It's important not to give them a bottle overnight.
How come? Why?
Well, the sugars in the contents of the bottle, if it's apple juice, is very bad, or even if it's milk, even breast milk, these sugars break down to the same sugar that makes cavities, which is a simple sucrose. And the way it works is, to keep it simple, the germs eat or consume the substrate, which is the sugar, and they poop acid. That's basically what it is.
So it dissolves the teeth.
The acid dissolves the teeth.
Because a lot of parents know that the term baby teeth. Tell us a little bit what that means.
That just means primary teeth, the teeth you get first. When you see the baby teeth in a child's mouth, the adult teeth are like right under their eyes and in their jawbone, forming, growing. Bob has imaging technology that general dentists don't have, and if you ever, I'm sure, right, you could explain that if you take a scan, you'd see all these teeth, all over the mouth.
And do parents have to worry about the baby teeth? I mean, they're going to go away anyway. They're going to fall out.
You do get a do-over, but the baby teeth serve a valuable purpose. First of all, a child's self-esteem it can be seriously affected by having hideously malformed, ugly teeth that could have been beautiful, but were ruined by cavities. Or even if those teeth are removed, now the child is healthy, there's no disease, it affects their self-esteem to not have teeth. Shirley Temple, famous actress who was at her time the most highest paid performer in the world, used to act in a movie, and as a small child she'd lose a baby tooth. And what are they going to do? You have this bankable star, like the whole production depends on her. So they invented something called a flipper. That's how they started. So Shirley Temple could keep filming. They're little tiny teeth with a little denture base that went in her mouth, and the show went on. So today we do make them We make them mostly for adults as a temporary measure while they're waiting for their implants to take. But dentistry can adapt. Dentistry is versatile.
So let's go from one step, and we've got Bob here today. So if someone comes into you, and when is in your mind that you need someone to go to an oral surgeon?
Oh, it's very simple. If I see an impaction,
Which means
a tooth that's stuck in the jaw,
like a wisdom tooth particularly?
it doesn't even have to be a wisdom tooth. It's often a canine tooth.
So and to tell us, where are the wisdom teeth, where is the canine teeth?
The wisdom teeth are behind your last tooth, or they are your last tooth, depending on your state of growth and development. And the canines are your fangs, your eye teeth. They're very prominent and they're very important for your cosmetics. And also the jaw turns on them. If they're not there, it's a big problem. So an oral surgeon and sometimes an orthodontist, depending on
what kind
a
of
braces doctor.
Uh-huh.
Sometimes they team up for, what is it called, when you drag the tooth
Well,
down?
sometimes you have to, and this is getting back to children's dentistry also, because in the child, not only can you have cavities, but you could also have developmental problems, meaning that there's a whole sequence that the teeth grow into, the baby teeth are lost and the grown-up teeth grow in, and sometimes that sequence goes bad and the adult teeth don't grow in. Probably the most common teeth that don't grow in are the canine teeth in young children, and those are the most important teeth in the mouth. Those teeth are, as Neil mentioned, are the anchor teeth, but they also, if you ever feel your lip directly above your canine teeth, you'll feel a lump there, and that's called the canine eminence. That actually, if you lose the canine tooth, your face will collapse. The teeth underlying your skin support your face, so it's very important to try and keep those teeth if you can. It's really a shame when I see people losing their canine teeth. So if a dentist is screening a child and he's noticing that the baby canine teeth are staying for too long a period of time, he may refer that patient, or may try and take an x-ray to see what's happening with the grown-up canine tooth. And if it looks like the grown-up canine tooth is stuck in the jaw, meaning impacted for whatever reason, the dentist may want to refer that patient out to an orthodontist, a braces doctor, for an initial evaluation, or to an oral surgeon. If it turns out that the child is not growing their canine teeth properly, or any other tooth either, but mostly it's the canine that you deal with, there are procedures that you can do that will assist in the growth of those teeth. They involve braces, but you can really help those kids out tremendously.
So one last small thing we're going to talk about with children and even with adults, and we're going to go a little bit more into oral surgery. Tell me a little bit about brushing people's teeth. Dr. Mitnick happens to be my dentist, and my kid's dentist and family dentist. That's why we're here today. And you told me about an entity that I really wasn't that familiar with, and you're talking about people over-brushing their teeth.
Oh, yes.
And so tell us a little bit about the enamel, what the tooth is made of, and how should people brush their teeth? With a regular toothbrush, electric toothbrush?
Okay.
Give us this story.
All set.
Okay.
So first of all, if you would take your car to a car wash, you want a what? A brushless car wash. Because if it's too much abrasion on the coat of paint, it will take the paint off. The enamel of teeth is a one-time thing. You don't get a do-over like if a baby tooth is ruined and the permanent one's going to grow in.
And the enamel doesn't heal.
It doesn't
Not
heal,
like
it doesn't
skin.
recover, no. So you have to take care of your enamel by brushing it not too soft. It's like what do you call Goldilocks? Not too hard, not too soft, just right. Because if you brush too little or too soft, you'll have a buildup of plaque, which will have the germs, which will eat the substrate and poop acid and burn holes in your
Cause
teeth.
cavities.
Yes. So you want to use a fluoride toothpaste, which is ADA approved. Now, there are companies that make toothpastes which don't have fluoride, and there's research on the ADA website, you could look it up, that links those toothpastes to not preventing cavities. They do a lot of other things, and that's great, but you must have fluoride to prevent cavities. Sorry.
So those are most of the commercial dental products you're talking about?
I will just say the easiest blanket statement, go with an ADA approved product.
And it says so on the box.
It says it right on the box. So that's what you're starting with. If it's a child who can't rinse, there are toothpastes without fluoride special for them that are made by the same manufacturers that are meant to lead the child into a fluoride toothpaste when they can rinse. They're meant to simulate these fluoride toothpastes. So It's either a fluoride toothpaste or one of these training toothpastes. Fine. That's the first thing. The next thing you want is the brush, the actual brush. So I only advocate soft toothbrushes. My policy, and it's not just mine, but I happen to be on the front line, so I say it, is brush smart, not hard. Brush smart, not hard means brushing correctly so every surface is brushed, but not hard. Not that you're going to abrade the enamel or the gums.
What happens if you brush too hard?
If you brush too hard, you could rub away your enamel and make a notch. It looks like your tooth will look like it has an axe taken to it and a notch chopped out.
Like a tree chopping down a tree.
Yeah, yeah.
What about electric toothbrushes?
They're fine if they're used correctly, and I'll go one further. For small children, there is research that supports kids using spinning toothbrushes. They don't have to be $100. They could be a $5 one from your local pharmacy that has like a Disney princess on it. Those are great. They're cheaper than replacing the batteries, and anyway, they need to be changed every so often. So kids who use spinning toothbrushes are less afraid and less traumatized by their first experiences at the dentist, because the dentist uses, whether it's a rotary brushing instrument or even a drill, has the same sensation as that spinning toothbrush. So they freak out less.
So good hygiene, of course, is important. Now, that we have Bob here today, and you've also taken care of my family with their wisdom teeth, so thank you. Tell me a little bit about what's the most common referral that you get to your practice?
It really depends upon the age of the patient. For youngsters, the most common referrals that I get are baby teeth that have been that became abscessed. Now the kid's dealing with an infection. Also, in that age bracket, you look at those, as we were talking about before, those grown-up teeth that are locked in the jawbone and they're not growing into the mouth, and we have to kind of head those situations off to pass. That's probably in youngsters. As we get more into the teens and adolescent years, it's a lot of wisdom teeth that come into vogue.
Which you're wearing. Again, we said the back here. How do you take a wisdom tooth out?
There's a lot of different types of impaction. We have to kind of like classify them. Some impacted teeth are laying on their side. Some impacted teeth are laying backwards. Some are laying kind of from the middle of your body to the outside. So each one requires...
Can I just add? I've seen horror stories of a tooth with the wisdom tooth growing into the tooth and ruining the tooth in front of it.
Right, that's due to a lack of diagnosis. You want to try and, that doesn't happen until the patient's maybe at least into their 20s or 30s.
These are people who suddenly show up at the dentist and they go, ow, and they haven't been,
and they end up losing a good tooth in the process. Yeah, so the wisdom teeth, we actually rate them according to how deep they are in the jawbone. Some wisdom teeth actually grow into the mouth and they're not quote unquote impacted, they're just fully functional teeth. And it's a little bit of a controversial area in dentistry whether or not you have to take those teeth out. I'm not somebody who tells everybody who has a nice healthy wisdom tooth to take it out, but because the wisdom teeth are the last teeth to develop in the jaw, and I guess because of evolutionary reasons, some of the wisdom teeth don't grow into the mouth correctly, and they remain what's called impacted. So sometimes you might see a wisdom tooth when you look in a patient's mouth that looks like it's teething. But the difference between that tooth and a teething tooth is that it might be there for 5 years in that same teething state. So when you have a part of the gum which is covering the chewing surface of the tooth, bacteria can get caught in between that gum and the chewing surface, and you get an infection. And it's very difficult to take that gum away. What you really need to do is take out the tooth. By just cutting the gum away, it tends to grow back.
Let's go back a little bit. Tell me about x-rays. As a neurologist, all my patients are concerned every time I send them for an x-ray, CAT scan, things that we do a lot of. When they go to the dentist, so often you guys do x-rays. And the concern, and they put the lead shield on people, and everybody says, wow. Is there a danger or a significant danger with x-rays in dentistry?
First of all, I use Bob as my radiologist often. I will send him cases, because my x-ray is like small. And if I want context, I ask him for a panoramic or even a scan. So Bob will explain that, but I just want to say that dental radiography is very, very safe. And not only is it very safe, it's getting and has gotten safer. With the advent of digital x-rays, One film, I forget the amounts of rads or whatever, but one film today is a 10th or a 12th as much as one film was 30 years ago.
So when you go to your dentist, how do you know what kind of equipment they're using? Do you know that they're using the state-of-the-art? Do you
okay.
ask your dentist that?
Well, every dentist is licensed by the state. You should see a license certificate on the wall. Every piece of radiation equipment
to be
has its
licensed.
own, what do you call it,
They
registration?
come in, they test it.
It's, yeah, but you could see the certificate somewhere. It's on the wall. You're supposed to post it noticeably, whatever.
It has to be
Yeah,
noticeably
yeah.
posted.
So these things are there. I mean, if someone is practicing dentistry in the state of New York, you can make certain assumptions of safety. You know, you could.
older machines,
it's
newer
regulated.
machines,
Everything's regulated. Yes.
But I think even the older machines, when they were using film technology, even those were not so bad. The dental X-rays. But you know, I have a little bit of a different take. I don't want to say that X-rays are safe or dangerous. Obviously, you want to be exposed to as little amount of X-rays you can be exposed to in your life. Just like in medicine, you know, CAT scan. If you take a CAT scan of somebody's brain, they're going to get a certain amount of radiation. But when you decide to send somebody for a CAT scan, you go through a thought process beforehand.
It's a risk-benefit assessment.
Right, same thing. So the risk-benefit ratio exists with dentistry too. So you don't go fishing around people's bodies with CAT scans typically to look for something that you don't suspect is there. But you do certain X-rays on people, like mammograms are recommended for women to rule. So I think that you could look at a typical series of dental X-rays as equivalent to a mammogram. You're going in there, you're X-raying for the purpose of looking for something that might be wrong, because there's a good possibility that something might be wrong.
And how often do you do X-rays?
Well, I do maybe once a year, depending on the patient or on the family. You could tell a family that's an immigrant family, they did not grow up in the United States, they did not have fluoridated drinking water, they're going to get cavities more often. So if I see a trend like that, not that I see an immigrant and I take more X-rays, if I see that they're getting cavities more often, which happens to be associated with third world countries, then I will X-ray them more often at a rate where I'm comfortable knowing that if anything new is going to happen, I'll spot it before it's a root canal, you know?
Yeah.
Okay.
I think you have to exercise judgment. I have an option now in dentistry. There's been the advent of what's called a cone beam CAT scan machine. Now, the cone beam CAT scan is not the same thing as a medical CAT scan. It uses similar software, but the way that the X-ray is acquired is a little bit different. It's a much lower X-ray dose. But even with that, whenever I use that machine, I have to be able to justify in my mind why I'm actually exposing that patient to the X-ray. So, for
it's all
example,
computer reconstructions and things like
right,
that.
but it involves many more images that go. It's you know, I think once in my machine, one scan is actually 300 separate images. But let's say, for example, I have a situation where somebody has a wisdom tooth that has to come out. And one of the known problems with taking out wisdom teeth is that there's a nerve that travels to the lower jawbone. It's called the infraalveolar nerve, trigeminal nerve. And sometimes the roots of that tooth might be very close to that nerve. So when you go to take out that wisdom tooth, you might injure the nerve and cause somebody's lip to become numb. So, all right, so typically I don't take a cone beam CAT scan on every kid that walks into my office who needs a wisdom tooth out. But if I see on the Panorex, which is the screening X-ray that everybody gets when they have their wisdom teeth taken out, that root looks like it's crossing over the nerve, then I might recommend that they do take that additional X-ray so I can map out in 3 dimensions, as opposed to most X-rays are just in 2 dimensions.
They're flat.
Right, they're flat. They just kind of flatten everything out.
I'm going to move on from X-rays.
Can I just make
Yes,
a point?
go, tell me
Which
now.
camera is showing right now?
The one with the red dot.
This one?
Yes.
Okay, so my finger's touching this finger. Looks like it, but you don't know. This is what a cone beam can do. It will capture it from the side. And you could see that it is or is not touching. This is previously impossible using a regular dental X-ray. So if I see something like this, I send it to Bob.
So it gets a better picture.
Yeah.
So I'm going to go into a few more topics because I have you guys here and I don't want to talk about the details of X-rays too much longer. Tell me what a root canal is.
Root canal is performed on a tooth. Well, okay, the tooth, think of a tooth as a hard structure, like almost like a bone-like thing, but it has a blood vessels inside of it and nerve tissue inside of it. When that nerve gets inflamed by maybe a cavity that's close to it,
Too deep.
pressure builds up inside of the tooth, and the nerve dies. All right, when the nerve dies, as it's dying, a lot of times it causes a lot of pain, or after it's totally dead, bacteria grows inside of that nerve chamber, and it makes gas, and the gas goes out into the jawbone, and it causes tremendous pain. There's basically two ways that you get toothache pain. One is when the nerve is dying, when it's very inflamed and it's dying, and the second way is after the nerve dies that it gets infected inside. So what a root canal does, a root canal is a way to...
It's a procedure.
A procedure that's done on a tooth where the nerve is either dying or dead already, that enables you to keep the tooth despite the fact that the tooth is essentially now dead. So what's done in a root canal is you go into that nerve chamber, and the dentist or the root canal specialist will actually, using special instruments, take out all that dead tissue and replace it with a filling that runs the entire length of the root of the tooth.
Yeah, they could be like 25 millimeters long.
Okay. A couple of more topics. This is going to be like sort of rapid fire. We've talked about cavities a lot. Tell me what a cavity is, and how do you get them, and how do you prevent them?
A cavity is a hole in a tooth caused by germs. The hole could be surrounding a pre-existing filling, secondary decay, old filling, or it could be new, a virgin cavity. And the cavity worsens because the germs keep getting food to eat, and they keep producing acid, and the hole gets bigger and bigger.
And the treatment for a cavity?
You drill it out, and there's a man named G.V. Black many years ago who made a series of shapes which hold through to this day, and they're probably not going to change for a long time, that if you make these shapes for these surfaces and you put a filling in, it will hold.
What do you fill it with?
Okay, so a tried and true, grandfathered in material is dental amalgam. Dental amalgam is silver and other metals and mercury in an alloy. It's falling out of favor for many people. They don't want metal in their mouths. So initially there were composite resin. What was before composite? It'll come to me. Composite resins, which are bonded into the tooth. They do wear faster than amalgam does, or gold, or any other metal. But they've been improving them with hybrid technology, adding filler materials. And there are better and better composites.
So they've gotten better over time.
We also do inlays, which is a glued-in filling, boom, made out of ceramic or composite, and they're very good. They're better than silver, and they're tooth colored. They happen to be a little more pricey, so some people don't opt for them, but they're very nice.
Okay. Bob, we left sort of the best for last. The idea that people that I remember when I grew up used to take their teeth out and put it on the table just like this. Now we see a lot of television commercials. We see a lot of people talking about different kinds of implantation. I know that's one of your specialties. So tell us a little bit about implants, who they're for, what you think about, how it's done, and maybe just give us the ABCs of implants.
So the first thing I want to say is that there's no cookie cutter solution with dental implants for every patient. Every patient is an individual, and when a patient goes to a dentist to be evaluated for implants, it's always, you have to go through a whole process of a proper diagnosis. So some examples of people who might want implants might be somebody who has no teeth, and they're going to get a full mouth of teeth with implants. Another example might be somebody who's lost their front tooth, and they just have to replace their front tooth with the implant. And the treatment is actually quite different for those two patients. And there's everything in between. I brought a couple of models here that just might illustrate some of the scenarios that come in. So if you could just ignore, these are dental implants here with the bar in between, but this is somebody's lower jaw. It's a patient who's lost all their teeth. So if you just forget about these implants here, what would have been done for this patient in the past is a denture would be constructed. A denture is
a false tooth.
False teeth. It provides, and this is very important, it's a little bit more of an advanced concept, but when you make a denture, when somebody loses their teeth, and I should have brought in another model, the bone that supports the teeth oftentimes disappears after the teeth are gone. So what happens is not only do you lose your teeth, but you lose the support of the bone, so your face starts to collapse in. So if you ever see somebody who has full dentures, when they take their denture out, their face falls in. So what the denture does, in addition to having the teeth, if you see this pink material here, it has a certain thickness to it. This is actually returning the thickness of the bone that was lost to that patient after they lost their teeth. And as patients go for longer and longer without having their teeth, they lose more and more bone over time. So this denture, forgetting about when you put the denture in, it's replacing the teeth, but it's also replacing the bone that was lost, so that helps hold the patient's face out. Now, what you can do with implants, a very simple treatment, and one of the more least expensive ways of using implants, is you can simply, if somebody has a denture, when they lose a lot of, the dentures sit on the bone, and sometimes the bone is not thick enough to hold the teeth any longer. So you can do a very simple thing, which might involve placing 2 implants on a patient. And the bar is kind of old school, that's not done so much anymore, but we have these special male and female attachments. One part goes inside the denture and another part goes into the implant, so that when the patient puts their denture in, it snaps in and it doesn't flop around.
And it stays there permanently?
No.
Take it
So
out.
the advantage of this is that the patient takes the teeth out every night. When they're in pretty solid, but they can pop them out. And then, the implants themselves, I want to really, if I have to make a point to people who are looking into implants and considering getting dental implants, I think it's very important, and it's not spoken about a lot. But the implants themselves are indestructible, but the bone that the teeth that the implants sit in is not. So it's very important to maintain, just like you would maintain around your own natural teeth, very good hygiene around the implants. So
Most people don't.
you have to be able to keep them clean, because if you don't keep them clean, you can lose the bone around the implants, just like you lose the bone around your teeth. So what I like about a setup like this, and there's all different setups, is that when you take the denture off, you can clean the implants, and they tend to maintain their bone very nicely over time.
Okay.
That's one example.
So tell me about the implants that we hear about on television.
Tooth in a day.
Tooth in a day, things like that.
Yeah. So I want to, if you want me to discuss
We've got
this,
2 minutes left, so you're gonna have to
well,
give
I've
us
done a
quick
lot
one.
of tooth in a day cases, and I think it's not for everybody. Certain patients are very good candidates for it, but I think that again, this is my original point where I said you cannot take a cookie cutter approach to every patient. So with the tooth in a day scenario, the patient needs to have enough of their own bone, and the conditions have to be right to do that. And in certain cases, I don't believe that every patient is a candidate for tooth in a day. In certain cases, it could be very amazing, dramatic makeover. You see commercials all the time where people get their implants and they bite into an apple. That's great. And it really has a tremendous wow effect. But you have to really start to, and there's not time here to discuss this, the long-term success of these cases come into play.
Yes.
There are 4 entities involved in making a good implant scenario. The first, in no particular order, the manufacturers of the implants are constantly researching better ways and different techniques and sizes and shapes, and it's like Bob's job to select the right ones. Then there's a general dentist who gets a patient and says, "Oh, you'd like implants? Okay." Send them to the surgeon who does the surgery.
Neil, we've got 30 seconds.
Then we
to go
have
through
the
this quick.
dentist and the laboratory.
Uh-huh.
I wish the laboratory could, that's a whole show probably right there.
Okay.
The intricacies of making teeth for the patients.
So you basically have told me that we need to do another show.
You're reading my mind.
We have to talk
Just
about
on implants.
Just
Yeah.
on
Just on
implants,
implants.
It's a team
laboratories,
approach.
all
Yeah.
kinds of things like that. I want to thank you guys for coming here tonight. It's been a great pleasure to have you, 2 experts in your field, people who take care of the community on Staten Island and all of New York. And just the idea of how people sometimes don't take care of their teeth, and how important teeth are to everyone in the community. And I want to say thank you, and hopefully we'll do this again real soon.
You're
Thank you for having us.
You're quite welcome.